Regional Health Clinic of Minnesota is providing this presentation to you in order to explain the new changes taking place at the clinic. My name is Laura Lane Genke, and I am the clinic nurse informaticist that will be explaining the benefits of implementing the EHR and linking it with an HIE at Regional Health Clinic of Minnesota. Our objectives today are to define or explain what an electronic health record is, to describe how you can benefit from having an electronic health record, to explain what an HIE or Health Information Exchange is and what its benefits are. We will discuss what your role is with all of the changes that are going on, otherwise explained as patient engagement. And then finally, I will introduce the new clinic technologies and explain how your clinic experience will be changed. Let's look at EHR. What is an EHR? An EHR is an electronic health record. An electronic health record is created by taking your health information from paper and converting it into an electronic version that can be accessed and viewed on a computer. Your health information will be readily available for secure viewing by you, your physician, your nurse, or others that are involved in your care. These would be people that would have permission to access your health information. Having your health information in an EHR form allows broader viewing of multiple health records instead of the need to page through mountains of paperwork. So, let's look at some of the benefits of having an EHR. Having your records in an electronic form will potentially increase the quality of care that you receive. Because your health information is more easily accessible, more information and background can be accessed, providing the doctor or the nurse more accurate information, allowing for better assessment and established plan of care. Having your records in electronic form will also increase safety. Your paper chart will no longer be kept in a folder in an office file cabinet. Instead, your records will be stored online securely, and access will only be obtained using a secure password. Your records are kept both secure and private. Efficiency also increases using an electronic health record. The EHR can be accessed in real time at any time. So no need to wait for a paper chart to be scanned, faxed, or sent to a specialist or other care provider. This really saves time. Looking at electronic health records, providers will see what tests and procedures have already been completed, and this eliminates repetitive or unnecessary tests and procedures. The EHR will also increase efficiency because forms won't have to be filled out over and over again. There are also financial benefits to using an EHR system at our clinic. As mentioned earlier, not repeating tests and procedures will eliminate double charging fees. Another financial benefit is clinic savings on storage fees for old charts. Overhead cost savings at the clinic may mean less miscellaneous charges for you and your end. Now, what is an HIE? An HIE is a health information exchange. A health information exchange is the exchange of information across various health systems. A health information exchange is a way of providing access to your electronic health records. So in other words, your electronic health records are linked on a health information exchange in order to provide access and share information amongst providers. An example would be the ability of a specialist, let's say your endocrinologist, to look at your chart online and see what your primary doctor wrote or what previous tests were performed or lab results from a lab at another facility. Another part of the health information exchange is the provision of an infrastructure for research. What this means is that health information exchanges can track public health and biomedical research. Let's look at health information exchange in pictures. Here's a picture of some of the different ways health information can be exchanged between systems. I will not go through every picture, but let's look at a couple examples. Let's say you are receiving some community health services at home, such as a home health nurse visit for wound care. Your care can be documented in your EHR, and your surgeon can access your chart to see how your wound is healing from the confines of his office or perhaps even his mobile phone. Another example would be your scheduling your mammogram online at your gynecologist's office. You can visually see here how exchanging health information across systems has many possibilities. Let's talk a little more about the benefits of a health information exchange. One of the benefits is quality. A health information exchange increases quality because the information that is needed by the various people participating in your care are able to readily receive the information. Another way quality increases is that providers have better communication amongst each other because they're all receiving the same information and have access to the same information electronically. Another benefit of HIE is safety. Because care can be coordinated between healthcare providers, you are provided more safety because things are not repeated, things are not missed. Because of this, errors are reduced not only in clinical practice, but also in charting. So much of the information that may have been eliminated or may been a mistake is completely eliminated using an HIE. Efficiency increases because there's less paperwork, of course, as we discussed earlier, and also because there's timely access to the information that's needed. Anyone can access it that has permission from anywhere that they may be on a computer. There are also financial benefits such as detection of any kind of fraudulent use of healthcare or tracking of costs versus benefits. What this means is that they will track healthcare that is benefiting the patient and relate that to cost. If there are things that are not benefiting the patient, then those will be eliminated. Therefore, the cost will be eliminated. So, now we're going to look at patient engagement. This is a diagram of how patient engagement can be represented. So we have three circles and there is one area of intersection here. Let's discuss this further. Now let's talk more about what patient engagement is. Patient engagement is involvement in care. Patient engagement is participation in the changes that are occurring at your clinic. We are going to make patient engagement be the standard of care at our clinic. Patient engagement means you are going to be involved just as much as the healthcare provider is involved in your care. We want to improve patient satisfaction, and we feel that this can occur through the four principles of patient engagement. These are respecting your dignity and respecting you as a person by involving you in your care. We want you to do information sharing, which means you will be asked about your health care. we want you to participate in making sure that we have all the information that's needed to best care for you as a person. Patient engagement means you will be participating together with us on your care, and then we will all collaborate using the technology that's provided to provide you with the best care that we can offer. So let's talk about what's going to change at the clinic. What's going to change at the clinic is you will now have access to making an appointment online and being able to pre-register online. This will eliminate some time spent filling out forms at the office or having to come in early before your appointment. We're going to have a computer check-in when you arrive at the clinic, and once you check in on that computer, which we will teach you how to do, you will immediately get a room that you can go directly into, and that will eliminate you waiting out in the lobby. We will provide you with an ID band with barcode identification, and we will use that to be able to document everything about your office visit and the care that we're providing you. That will all be documented in your electronic health record. Then together we're going to review your electronic health record at your visit so that we can make sure that what we see in your record is accurate per your recommendations and information that you're giving us. And then we will be having digital prescriptions sent directly to your pharmacy that you've designated, so that will save you time, and the pharmacist will be able to start preparing your prescription before you even leave the office. So, new technologies that we'll have at our clinic. Number one is we're going to be launching the electronic health record software on all of our computers. They'll provide a patient portal for you. In other words, there will be access on the computer to your electronic health record. And we will provide you with the mode of access and how to set up your password. You can schedule your appointment. You can look at test and lab results. You can also review education materials. So if you want to review information about what the lab test is, what the procedure or surgery you're having is, if you just want to learn more about a certain symptom or an illness or a diagnosis, all of that information will be at your fingertips on the computer. Your medication will be listed there, so you can certainly make sure you have a list of everything in case another provider were to ask you. You can renew your prescriptions online, and you can also email your clinician. As stated before, another new technology is the ID band that you'll be getting upon arrival to the clinic. And then we also will be providing you with activity trackers or personal fitness trackers that you can use on your phone, on your iPhone or what have you, if you so choose. You can also do secure bill pay online now. So let's take a look at a few of these pictures here. In the upper left-hand side is a picture of a physician and a patient reviewing the chart on the iPad. So you'll be able to look at your electronic health record on the computer, on the iPad, together with your care provider. On the right-hand side is a phone that has an activity tracker, and those things are certainly available to you now, so you can track your activity. And then we want to look in the lower left-hand corner. That's something like what your ID band will look like with the barcode. And in the lower right is kind of a snapshot of what your electronic health record will look like online when you access the computer. In summary, we've talked about the definition and benefits of both the EHR and the HIE. We've talked about patient engagement or involvement in care. We've discussed the new technologies that we have at the clinic and what changes will be occurring for you when you come to the clinic. If you have any questions, here's the clinic email. You also have my email as the nurse informaticist. You may also text or call the clinic at this number, and you can, of course, look at our clinic webpage. There are references available for you to look at if you so choose. Otherwise, we appreciate you being able to view this PowerPoint, and this will be available for future viewing should you want to. Thank you.